Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, social media and teenagers. Dr. Jaren Budak is an associate professor in the School of Information at the University of Michigan. She recently served on a consensus committee of the National Academies of Science and Engineering in Medicine entitled Social Media and Adolescent Health. She speaks with Dr. Josh Sharfstein about the committee's findings that there is not adequate evidence to find an effect of social media on adolescent health at the population level, as well as the finding that social media companies need to do much more to participate in research on the impact on teenagers. Let's listen.
Dr. Jaren Budak, thank you so much for joining me at Public Health on Call to talk about this report from the National Academies of Science, Engineering, and Medicine on social media and teen mental health.
Thank you very much, Josh. I'm looking forward to the conversation.
Now, this is a topic that has been quite in the news. We're talking just days after big congressional hearing where senators were very critical of some of the social media companies' leaders. And the CEO of Meta, Mark Zuckerberg, apologized to families in a dramatic moment. This report started a while ago, though,
Yes.
and I wonder why. What was the motivation for a thorough look at the evidence in this area?
Right. So a main concern was really disentangling the benefits and harms of social media use for adolescents. And maybe this is also related to the various news articles and reports around there that was causing concern. And the other thing was to really understand the relative risks and benefits so that we can understand the trade-offs between them. So that was our main charge for this particular report.
Now, I know when the National Academy does a report, it's usually not done over a weekend.
No.
You know, it's a lot of work. So how long did this take, and what did the committee do to get to the bottom of this question of the impact of social media on teenagers' mental health?
Yes. I should know the exact timeline. I think it was end-to-end a year of work. We had, I believe, at least 6 meetings. Some of those were public, and we had experts that came to us, presented their work. We listened to those. We asked them questions. Outside of these meetings, we were looking at the evidence ourselves. So we have over 300 works that are cited in the report. So basically putting those together, trying to understand the degree to which the evidence across multiple studies agrees, whether in direction or magnitude. So some of those were us doing a lot of reading and then a lot of writing. The report also went out to reviewers, peer reviewers, and then we received their reviews and edited our report as a result of that. So quite a lengthy process.
Got it. I mean, this is a topic in the news, and people may have their opinions about it, may hear about something that happens and reach a conclusion.
Yeah.
By design, your report was to do something different, which is to really look at what the evidence is saying,
Yes.
what has been studied, what is known, what is unknown.
Absolutely. And a main part of, I think, National Academy's reports like this is that it's a consensus report. So we had over, a large number of experts that were in the committee that were coming from, cognitive science, computational social science, economics, and so forth, coming from different perspectives. And at the end of the day, we needed to amass this large body of work. And as opposed to sort of focusing on one or two sort of main news articles that might sound concerning, we really wanted to understand the degree to which the evidence is there in a more broad sense.
All right. Now I want to hear.
Yeah.
What did you find after all of that work as you looked at the impact of social media on teenagers?
Yeah. So the very high level finding is that we found that there was not enough evidence to say that social media is having an effect on teens' health at the population level. That's important to highlight. But depending on the individual or the group that we're talking about, and that's discussed at length in our report, there are at times benefits and at times really important harms. So based on this evidence, what we did is to formulate recommendations for various different stakeholders, Congress, social media platforms, educators, to go back to our charge, which is to maximize the benefits while minimizing the harms.
So let's talk about the findings in more detail and then maybe some of those recommendations.
Yeah.
So you found some evidence for benefit and some evidence for harm, but the need for further study.
Yes.
What was the evidence of benefit that you found?
So benefits can come in various forms. So for instance, one of those is connection, social connection. And we see, especially through more qualitative and survey-based studies, that social media can help teens connect with community, especially when that community is not accessible in person. So this could be like a kid who lost a loved one, or an LGBTQ teen who finds it easier to find connections online as opposed to sort of in the physical world around them. And another example, perhaps quite vivid in our minds, is during COVID-19, where it was really hard to engage. Well, you couldn't engage with people in person. So these platforms were providing that connection. There's also things around independence, identity formation, participation in sort of civic life, those kinds of things as potential positives. In terms of harms, there are, again, many unfortunate examples. So we have, for instance, comparison, especially if they're like negative comparisons, can have for your sort of self-perception harms. But again, that varies across groups. Sleep is one that we looked into, or sort of sadness, depression. Those are the categories that we looked into. Again, depending on what groups, we see some evidence for some of these, but not consistently at the population level.
So on the harm topic, one of the things that some people have pointed out is that anxiety and depression reports have gone up quite a lot.
Yeah.
And that's happening coincident.
Yes.
The same time as social media use is taking off.
Yes.
Did you ask the question and answer the question, well, could those things be connected?
Right. I think that's a great question. That is, we're absolutely, at least in a temporal sense, seeing a correlation between these. And in also some studies that are looking at individuals themselves, you can also see correlation. So the committee was weighing studies that had a stronger causal methodology that really supports a causal connection heavier than perhaps those that were more correlational. And also, again, it might be maybe looking at like cohort studies as opposed to looking at cross-sectional studies. We were concerned about that concern, and that's why we actually looked at the large body of work here. What we're seeing is that across multiple studies, for instance, connection between sadness and social media seems to be either weak correlations or null findings is common across studies. So even though, yes, we are seeing this overall trend, we can't confidently say that the cause is social media, at least at the population level. So we start with that concern, but we still have to follow the evidence coming from a large body of work that looks at this using different methodologies.
Would it be fair to say that, look, if that big connection were true, you would expect to see that in the smaller studies too? That young people who are using social media would be the ones who would be more likely to be depressed and anxious, and that was not a consistent finding. Is that interpreting a little bit what you're saying?
I think I would maybe reformulate that a little bit. That is, whenever we find null findings, it doesn't mean the relationship is not there. It doesn't mean that the cause is not there. It just means that we didn't find it. So one of the reasons that we might not have found it, or at least across the studies that we looked at, is one of the challenges that we also highlight later in our report, in our recommendations, which is that people use different measures to look at the same high-level concept. So it might be that the studies are not agreeing because they are like using slightly different measures. And a lot of those studies, for instance, use social media use time as the measure. But again, we find in other studies that that perhaps is not a good measure, because there are some social media uses that are actually beneficial, while others are harmful.
So not just the time you've spent on your app. That's not necessarily a good way to assess. If you could look deeper, you might say the time you spent doing the more dangerous activities, maybe that would correlate.
Yes.
And so I hear you saying that really you didn't conclude that there's not a problem.
Absolutely not. Yes, we did not conclude that.
You concluded that the evidence that's out there is not strong enough for a definitive conclusion, and that more research is needed.
Absolutely. And I think that's a really key aspect to highlight for both policy and public discussions in this space.
So what kind of research is needed?
So this is related to one of the recommendations that we have in our report, I believe in chapter the 8.1. But basically here, missing pieces are in various categories. One of them is around mechanisms. So again, as I said, it's not simply just social media use, but it is different types of social media use, moderated or mediated by the contextual world that you live in. So if we understand the mechanisms, those are easier things to understand and change. So we have an emphasis on studies that look at mechanisms. The other is that a lot of work that's out there is using correlational evidence and experimental studies to the degree that that's possible, or natural experiments when not, would get us closer to this causal question. And another category is that, as I said before, that the scholars are using different measures. So we really need to have some sort of standardization of the things that we look at so that we can do comparisons across studies in a better way. And we also identified some categories of sort of research inquiries that seem like they could be fruitful, but not much work is there. For instance, a lot of the work here is on the adolescents' use, but perhaps not enough emphasis on the parents' use or the parents' role in this context. So those are just a few examples, but there is a lot to be done there.
I can appreciate that. You mentioned some recommendations, and you mentioned you had recommendations for social media companies. What were those?
We have a couple of recommendations that are related to social media companies. One of those is that one recommendation we have is that we are hoping that there would be a development of a new set of industry standards for the design, transparency, and data use by social media platforms, because social media platforms really vary in the tools that they provide, and it's really hard for adolescents and parents to understand which platforms are doing their best work to improve the health of adolescents. So we need standards to be developed so that the platforms can adopt them and be transparent about those kinds of standards. So that's one. The other one relates back to research. Part of the reason why we still don't know a lot in this space is it has been really hard to do research in this space. And again, this is partly because platforms are changing over time, and so trying to come up with an answer that is static is hard. But part of it is that social media platforms are quite protective of their data and are not sharing their data with researchers for improvements in our understanding in this space, and we are seeing that the trend is actually going in the negative direction. So we're seeing more and more companies that are closing their APIs, and threatening lawsuits against researchers that are trying to get the data in other ways. So we have a recommendation for social media platforms to share data with researchers and make sure that their terms of use are stated in a way that it is not threatening for good research to be done in this space.
Interesting. Any other major recommendations you want to mention?
So there are a number of recommendations that we have, for instance, in the media literacy space. So we have, for instance, that the Department of Education should draw national attention to a comprehensive K through 12 media literacy. This should also be reflected in the educators' education itself, which is our recommendation 6.2, and then also in the education of other professionals like the medical professionals that interact with adolescents. So these three recommendations really connect to the education piece. We have two recommendations that are related to harassment in particular. And one of those is that the social media platforms should develop sort of systems for reporting, follow-up, and finding sort of answers to cases of online harassment and abuse. But because there is this trade-off between us trying to solve these harassment problems, and privacy and data privacy, we also have a recommendation for the FTC to clarify their sort of definitions in COPPA, which is the Children's Online Privacy Protection Act, to make these reports easier on the side of the platforms. And again, we have another recommendation related to harassment, which is that U.S. Substance Abuse and Mental Health Services Administration should develop systems to support children and adolescents that experience digital abuse and harassment. And as I said, we had a number of recommendations that are related to how to make research in this space possible, as well as building these standards so that we can track them over time and we can compare across different social media platforms.
Absolutely. It's hard to summarize a year's report in one podcast, but you've done a remarkable job. Let me just ask you, what do you say to parents?
Right. So great question. I guess one of the main things that we had in our report is to have an open communication with your kids around social media use. So this is as opposed to sort of having these rules that are top down and not communicated well with your kids, because we're seeing that some of these like hard rules might make sense for younger kids, but as they go later in adolescence, perhaps open communication is, for instance, one of that more important perhaps. And the other thing is that the reason that we care about social media is not for the sake of social media, right? We care about that because we actually care about their health and mental health. So just really keeping an eye out for that sort of negative signals of that, and thinking about your social media use plan as a function of this, as opposed to sort of one size fits all. And the other thing that we have some evidence for from some studies is that your own social media use is an important factor here. So it's not just about paying attention to your kids, but how is it that you're engaging with your kids? How is their family life, and how are you in that family life as a function of how you engage with social media? So those would be some of that, but I think that we have a toolkit out there. So I would recommend that the parents look into that as well for more detailed information than I can share here.
Got it. Well, it sounds like this is a big to be continued.
Yes.
That there are some benefits. There's clearly some harms.
Yeah.
You're asking parents to really pay attention to this, and we really want to get to the bottom of it. And I hear you saying the social media companies really have to help
Yes.
us all get to the bottom of it.
Yes.
They have that obligation.
Absolutely. And I think that's, earlier in our conversation, another thing to emphasize again, so that the social media platforms are not like, okay, we're cool, like there's no effect. We're not saying that, right? We're saying that we need to understand this better, and they have a responsibility here. And it relates to that we had like one sort of parallel that we're drawing from, for instance, hotel industry. They're not really sort of causing people to, abduct people and so forth, but they are in a space. They have the platform and their means through which people perhaps do these actions. So they have a responsibility. So I think we can have a similar viewpoint when we're thinking about social media platforms, given the power that they have, and given that we still don't know, they have a responsibility to help us better understand and address problems here.
Well, Dr. Budak, thank you very much for joining me, explaining the report, and for the work that you all have done on this.
Thank you so much, Josh. Really was joy.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ciceri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.